Namaste Vidya, Hamesha Khush Rahe Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in the Faculty of Homeopathic Science at JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to continue with the neurological examination, and we are going to discuss about the various electrophysiological tests that could be done in case of neurological investigation, examinations of a psychiatric or neurological case. Let's start with the electrophysiological examinations. The first test is electroencephalography, that is also known as EEG. What is done in EEG is, it is a recording of electrical discharges or signals across the skull arising from the cerebral cortex with the help of scalp electrodes on 16 channels for 10 to 30 minutes. So electroencephalography, EEG, is basically what? It is the recording of electrical discharges or signals across the skull that are arising from the cerebral cortex with the help of scalp electrodes on 16 channels for 10 to 30 minutes. This is a very important investigation. The next important investigation is electromyography, or the EMG studies. Electromyography means recording of muscle potentials through a concentric recording that can be seen on an oscilloscope and heard through the speaker. The following EMG pattern can be demonstrated. So what is EMG, electromyography? It means the recording of the muscle potentials through a concentric recording that can be seen on an oscilloscope and heard through the speaker. The following EMG pattern has been demonstrated. Number one is the normal interference. The second one is denervation and re-innervations. That is spontaneous fibrillation potentials of about 1 millisecond in duration and 50 to 200 millivolt in amplitude are seen and are evidence of re-innervation. The third one is the myopathic. When the muscle is weak, the normal interference pattern is reduced. Short duration spiky fibrillations is occasionally recorded. So we have normal interference, we have de-innervation and re-innervation. And the third one is the myopathic, where there is normal innervation pattern is reduced and short duration spiky fibrillations is associated, occasionally recorded. The third one is basically the nerve conduction. Nerve conduction means recording of the action potential by needle electrodes. So in nerve conduction, we are recording the action potentials by needle electrodes. 4 measurements are principal value in diagnosis of neuropathies and nerve impairment. Number one, we have mean conduction velocity, that is motor or sensory. Second is distal motor latency. Third is the sensory action potential. And the fourth is muscle action potential. So in nerve conduction, there is action potential by needle electrodes, and we have 4 measurements are principal value in the diagnosis of neuropathies and nerve impairment. Means number one, mean conduction velocity, example motor and sensory. There is distal motor latency. Third is sensory action potential, and the fourth one is muscle action potentials. The fourth is the evoked potential recording. So how to measure evoked potential recordings? It is basically visual evoked potentials, VEP, records the time taken for the response to a retinal stimulus to travel to the visual occipital cortex. The dominant response wave from a normal eye is positive wave, peaking at about 100 milliseconds. Next is the cerebrospinal fluid examination, where a lumbar puncture is done to draw the CSF for examination. So here we had evoked potential recording, where the visual evoked potentials were recorded time to time for the response to a retinal stimulus to travel to the visual occipital cortex. The dominant response wave from normal eye is positive wave, peaking at about 100 milliseconds. Hello. In the next, the lumbar puncture is done to draw the CSF examination. Next, we have the miscellaneous test. In the miscellaneous test, there is an estimation of serum enzymes that are released from the muscles. The enzymes include CPK, aldolase, transaminases. The elevated levels of these enzymes are seen in acute poliomyositis, the muscle dystrophies, estimation of serum copper and ceruloplasmin in Wilson's disease, estimation of antibody to acetylcholine receptors protein in myasthenia gravis. So I will again repeat the test in a very short brief. We had electroencephalography EEG. Next, we had electromyography, that is AMG studies, which had normal interface, de-innervation and re-innervation, myopathic. Third one was the nerve conduction for mean conduction velocity, distal motor latency, sensory action potentials and muscle action potentials. Next one is the evoked potential recording. Next is cerebrospinal fluid examination. And last one is the miscellaneous test to check for the serum enzymes, estimation of serum copper and ceruloplasmin in Wilson's disease, and estimation of antibodies to acetylcholine receptor protein in myasthenia gravis. So this was all about today's lecture. In the next lecture, we are going to start with a new chapter, that is hematological disorder, and we will be discussing about the etiological classification of anemia. So this was all for today. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.